The application of a third order bend in the mouth. We want to highlight the fact that when you're in 1925 stainless steel and you want to put in a third order bend, sometimes it's very hard to close the gate. So we're going to talk about the options of using TMA for that bend or stepping back to a lower strength stainless 1625 stainless steel. So this patient, Diana, she starts her case very crowded. The lower incisors have not been engaged from day one. There's been coil spring used, but then as the coil spring has been lassoed to the tooth 4-2, the 4-2 has tipped rather than bodily moved. So now we're faced with a situation where the teeth are well aligned, but tooth 4-2 will need some root torque. So the root would need to move labially. So that can be called negative torque. Depending on the way you look at it, the root is moving forward or labially, the crown is moving back lingually. Now, to do that bend, we use individual torquing pliers, known as the Rose torquing key. In the previous wire bending demonstrations I've done, the pliers that we had used were one plier and a flat turret. This is actually the proper set. So now I'll demonstrate what we're going to do in the mouth. This is a 1625 stainless steel wire. We would place it in the mouth, mark the midline, and put a dot on either side of the tooth that we're about to torque. That dot allows us then to locate exactly where the torque will be placed. So we then grab the wire in that position, and because we want negative torque, we're going to place the negative torque of 20 degrees by just lifting this up. There's the torque place, probably hard to see in the camera. We check then by putting the wire back down on a flat surface that we haven't introduced any unwanted bends. And then we'll place this in the mouth, make sure the wire is engaged to the bracket before closing the gate. So let's look at that now clinically. So continuing on from the technique exercise we showed, which was the placement of a third order bend, in this case a negative torque to a lower incisor, tooth 4-2, that has been tipped forward during the alignment process. And we'll look initially from the occlusal to see that the root of this tooth is still very lingual, and we need to place torque for that. So it's Dina, you were saying that right? Yep. How long, you can take your glasses off if how long you had the brace on now? Probably 14 months, I think. Great, okay. So can you give them a big smile there, see? And we're looking now at case finishing. So the centerlines are on, the canines are in class 1 bilaterally, molars are class 1 bilaterally. So the last thing we need to do before we take a brace off, and I'm sure you're dying to have your braces off, okay, is to detail that tooth. Because if we don't, there's more chance of periodontal problems occurring around this tooth when the patient gets older. Once that tooth is taut adequately, we'll take an impression to make a V-loop retainer, and that's one of the other techniques that we're going through later today. But you can see the tremendous benefits of the Damon system. Large overjet, severe crowding that normally would have been a bicuspid extraction case. But if you just turn your head that way, just profile work, and just relax your lips there. But if you see, she's got a very nice profile. We draw a line from the chin to the lower lip, and we look at where that lies in regard to the nose. If we can see in her profile, it's very nice balance. So if you took teeth out in this case, even though it's crowded, I don't think it would be the best for the facial profile. So we're kind of having our cake and eating it. Right? So this wire we're going to put in, put a little bit of pressure just on that one tooth. Okay. So do you want to pop your glasses on, and then we'll just put that. So looking at the X-ray, you can see very good root parallelism in the upper and lower. You can see tooth 4-2 that has a much shorter root than the adjacent teeth. Many people worry that that's root resorption by just looking at OPG radiograph. Many times when lower incisors are proclined, you will see the short root, and that's what's happened here. The second way of checking is, of course, to look at the lateral ceph, and the root length on the lateral ceph will be normal, even though it appears foreshortened on the OPG. But the foreshortening is another clinical sign that there's a torque requirement. Just, can you get a real bird's eye view on the 4.2? So that's it, perfect. Now just with a probe, just if we point to 4.2 at the root.
So we can see, you can really see that root on the lingual standing out. And look at the sort of the other incisors. Even though the incisal edges are all lined up, there is a telltale biolingual sort of thickening of the tooth. It's actually the way the tooth is positioned in the bone. That's what we call torque. On the buccal, you see the opposite. You see excess gingiva.
Right, so let's take the wire out and then put the torque bend in. Maybe some IPS.
Yeah. So we'll take out the archway, lower archway. So basically we'll edit that, show the gates opening and pan across to this part of the pencil. So important that we mark on the arch wire, whether we use this arch wire or not, we'll still mark it where we want the bends to be. So using a Chinograph pencil, you can use those little disposable sticks that we use for marking dentures wherever you like. Easy on distance to the tooth, we're going to wipe in the torque. Now you have to visualise it. Which way do we want the torque to go? The lower incisors are sort of more upright, or the root tip is lying more buccal to the 4.2. So we want the 4.2 root to do this movement. So if we look down the long axis of the tooth, we want the 4.2 to move in the root tip to move in that direction, this direction. So we want it to come like so. So the same way we would do the bend in our wire would be this way. And that will pull that root towards the bottom.
He's always at the bottom third of the screw. Right.
Taking a look at our lockers. Insert marks it there and there. So can I get a 1622 stainless steel? The individual talking points. Okay. So put our midlines together, and we've got our markings on the old arch wire here and here.
So important to mark the midline.
Yeah, so the midline is here, and then we've got markings here, there, and there. Talking ply, individual talking plies, we grab the arch wire like so. Still hang on to that one. And if we can visualize it in the way that the patient's lower jaw is represented by the archway, I want the root tip to move in this direction. I want to kick that root tip forward. So I'll go back to my wire and I'll grab it like so, and I'll squeeze both ends firm, and then we want about 20 degrees in terms of torque. So we will hold tightly, but left and right firm, and we will wipe in this direction. Now that's gone just a little bit more than 20 degrees. That's because there's a little bit of play with the pliers. When doing that, you'll notice the arch wire will...
That's good, yeah, you can see the torque, good.
Look at the light, right? Yep. I lost it, there it is. Okay, you can see the torque has been wiped in exactly on that tooth there. So, I'll get my... Then what we do then, we inspect the arch wire. Sometimes if you don't put in your force evenly, you might create a little kink in the occlusal plane or the arch wire, so I'll just level that out. And other times you may find you increase your width. Just inspect your arch wire to make sure that it is fine, and then inspect that your torque is exactly where it was. Old arch wire. So I'll just cut my arch wire to where I want it. Put my midlines on. Let's see that. And then cut this way. Okay, so we just put our arch wire, that just doesn't cut properly. Little tip, if you always inspect your arch wire, if you can see it cut, you can see just on the tip of that wire there, it bent rather than cut. So that will pose a problem when trying to put that into the buccal tube. So I'll just cut that off before I put that in.
High speed?
High speed or a good end cut. Always easier to cut outside the mouth. Okay. Wire goes in.
I think when he does that, I've got it covered.
Huh?
So, yeah, close, yeah.
Yeah, yeah. So on lower 1625, right?
16.5, yeah.
These are my PS or
No, that is there. There's a good dust on the distance of the two.
second?
There's a good dust on here, just distant. So,
This place, okay,
yeah,
good.
it's
Yep.
room. See, we mark it, and where our torque is. We want to make sure this bit of torque that we wipe into the arch wire.
So the next kit is an important one for taking
Probably better off getting you've got to get my nose to retract and I'll take the photos and you can commentate.
Okay, fine. Yeah.
Any chance
So it'd be really good because the hardest thing is the retraction.
Yeah, no, she'll do better than I will. She'll do better than I will. Yeah, no, we're finished. We don't have to
Actually, no, we'll put the power chain.
Okay, this is the power chain. We've got a 6-6 power chain. We're going to place some power chain here because we've got a little dice opening up just there. We don't want that getting any worse. Bind together, you'll see that the midline. Well, midlines are coincidental. If anything, you can see the lowers potentially have to the left a little less than half an inch. less than half a millimetre. That equates to that gap there, so that it should centre up, all line up. So power chain, best way to hold it is from the second O-ring. Put your first O-ring over the brace, and then open nice wide. You can place your power chain over the, what do we call the tie wings of the brace. These are whatever in your twin brackets that David certainly does have two tie wings. Normally we put power chain, you'd like to put power chain underneath the wire. Just easier for, it doesn't cause any friction, especially early on in the case. It is advised to place your power chain under the wire. That way it doesn't actually have so much of bearing on the arch wire itself. You won't get as much friction. So that's 6 links of space power chain. Feel a bit of pressure there?